Central Alberta now has the most measles cases in the province. That's a concern for many doctors who are seeing this disease for the first time in decades, or ever for some of them. Dr. Peter Bouch is a family doctor in Red Deer. He's on the line to tell us what the outbreak means for his work and for his patients.
I did my studies and I worked a couple of years in South Africa before moving to Canada, 33 years ago, a long time. And I saw some measles cases there. I've never seen a measles case in Canada. And I think a lot of the new grads would, if they've never seen it, but when you see one, these kids are sick. They have a high fever, a barking-like cough, very specific spots in the back of their mouth, and then obviously the rash that starts behind the ears and spreads down the body. I think a lot of people in the Western world think of these childhood illnesses as fairly benign, but there are the odd case that can especially become measles encephalitis, which is an infection of the brain. And these are the poor children that are passing away. The risks of the vaccines are very minor compared to some of the possible risks of the diseases. If you look at a place like High Level has 11% vaccination rate. Tabor has 28%, Two Hills 25%. There's no herd immunity, and it's going to spread through those communities like wildfire. It's becoming a big problem, especially with our hospitals, our acute care centers, where a child would come in that would be diagnosed with measles, and they have to then try and put out a public warning to everybody that could have come into contact with that person. My answer to this and to other previous pandemics and other things was, get vaccinated. And if you are worried about if you're now a little bit older and you don't know if you were vaccinated, you can get blood tests to check your measles immunity.